You're listening to People Are Animals Too, Darn It, with your host, Mandy Evans, Executive Director of Panhandle Animal Shelter.
Hello and welcome to this edition of People Are Animals Too, Darn It. Today, I'll be interviewing Dr. Sara Pizano. Dr. Pizano has 30 years experience in animal welfare that includes work as a shelter veterinarian and surgeon, management in both nonprofit and government shelter, and is sought out as a public speaker on the national stage. As an animal shelter consultant, Dr. Pizano helps organizations establish responsible public policy, community programs, and implement best practices in a cost-effective way that ends the use of euthanasia as population control. Dr. Pizano has served as the Companion Animal Council for the Humane Society of the United States and currently serves as an advisor for both the Million Cat Challenge and Best Friends Animal Society. Consulting work ranges from hourly to project workshops and community shelter assessments to longer-term retainer projects. I'm really excited to talk to Dr. Pizano today because she's in the shelters every day doing the hard work. So let's hear what she has to say. Hello and welcome, Dr. Sara Pizano, to our podcast, People Are Animals Too, Darn It. I appreciate you taking the time to join us.
Thank you so much. I'm honored to be the first podcast guest. Thank you so much.
You're welcome. So today's subject is, hold on, I have it written down, embracing your community as partners. And I know that you spend a great amount of your time in shelters all over the country. Being a shelter leader, I certainly appreciate the work that you're doing, and especially having the ability to bounce things off of you, because I know that you're coming at it from a larger perspective. Your view is national. You're working with municipal shelters, private shelters, and within the government realm to make change. So I really appreciate that you're doing this hard work and that you make yourself accessible to people that have these questions to see if their ideas fit within the realm of the overall picture.
Yes, thank you. And I often say that I've devoted my career to sheltering to keep animals out of the shelter, right? Because we know that the best fear-free thing to do is to keep them in homes or keep them where they're in their normal environment. So that is ultimately the goal, and that doesn't happen without the community for sure.
Right. So one question I have for you is, a lot of people that enter into veterinary medicine or into sheltering really are dedicated to their own community, their own impact. But you've really dedicated yourself to helping shelters everywhere. I'm wondering what drove that decision.
Oh, very easy. So I was in very large shelters for years and felt the weight of all the symptomatic issues that you deal with because animals are coming in the shelter and maybe they're not leaving so quickly so they get sick, or there's mental breakdown, all these different things. And I felt like I was drowning in the symptoms. And I thought, wait, I think it could be better if we fix the foundation. And so I took a job as a public shelter director and then saw the changes that you could do just with public policy and updating public policy. And so I've just sort of become more global with each step because I feel, for me, that's how I can help the most animals. If I was in one little shelter, I would be helping those animals. But this message is so crucial and so important. And thank goodness it's scalable. It's every shelter can do these best practices. They are not out of reach for any community. So I just feel like it was my calling to affect change at the foundational level for for the sheltering system in the United States.
Yeah, and I think that that's the key to what you do. I have the ability to talk to shelters and go visit shelters, but I'm not doing it as a consultant. I'm doing it as someone that's just coming in and looking. And a lot of my messaging kind of goes deeper, like into the culture. And what I see is that people need to be focused on the foundation first because then they're more secure in the work they're doing. They're not having to put all these fires out all the time, and they're able to then be confident, in what they're doing.
Right. And I often say, we can't have a fear-free shelter environment if you're not operating your shelter at that, to the best of your ability. And that means everybody, the municipal leaders, your intake policies, your population management, it's the whole system. The system is a flawed system that was built in the early 1900s with no intentions of life-saving. And so many shelters are still trying so hard to work against that broken system. And so this is about, hey, let's get everybody in this 2020 is right around the corner. 2020, this is the year we need to get everybody updated.
Right. And so when you talk about fear-free, we're huge fear-free fans. We look at things from the perspective of, well, how do we make our environment for our dogs fear-free, and how do we make the cats fear-free? But I feel like an aspect that we miss is, how do we start to work with shelter leadership to help them not operate out of fear, and to help them respond to their community in a hopeful and not fearful way. Do you see a lot of fear when you go into, and understanding that fear isn't something that someone says up front, I'm fearful. It's really in the way that they're operating, their mindset. Maybe it's scarcity mindset. Maybe it's policies because they're trying to protect their animals so hard. They don't know that they're fearful. But do you see that a lot in the shelters that you're visiting?
Not a lot. I see it everywhere, every time, in every group, whether it's a public, private shelter, rescue organizations, it doesn't matter. I probably would have been more effective if I was a social psychologist, because I feel like most of what I do is unpack that fear. And, because we can't do that because there's this fear of a negative consequence. And so, let's see, why are you worried about that? Because we make these stories up in our head when we don't know what's going to happen. We make up stories. And so we then create policies accordingly without saying, wait a minute, look at, all these shelters around us that are doing it differently, and they don't have those negative consequences. I would say all of my work is focused on helping, educating leaders and all people who care about what happens in a shelter in a community, helping everybody release their fears and stepping out of their microcosm, because that's really what this is about, Mandy. All of us, you and me included, we have our own microcosm. We were raised a certain way. We had animals in our homes or not in a certain way. We have a certain education or not. And that makes up our microcosm. And that's where we're most comfortable. And so when I remember I was helping at a HSUS open adoptions forum, and the rescue group application, the very first question was, have you ever been convicted of animal cruelty? So we talked about open adoptions, and I said, I understand that's what you see and it's so hard, but you've got to step out of your microcosm. And this woman just broke down and she said, I really want to step out of my microcosm. I just don't know how.
Yeah.
So to answer your question, that was like the elevator speech, yes.
Well, and I think that fear is, like you said, really like this, we live in this really comfy spot. And if everybody looked at it in the terms of, my home is super comfortable, and every story that I make up about leaving my home, if I believe those stories, then I'm going to stay trapped in my home. And really, it's about saying, you know what? I'm not going to get in that car accident today. I'm going to leave my house. I'm going to live my life. And with leadership, it's about recognizing decisions that we're making that are based in fear, and they make all of us feel really good, but they're really counterintuitive, and they're not helping the greater good. Part of that is, like you said, the adoptions, with offering free adoptions. So that you've got organizations, I don't know if this is still happening, but euthanizing on one end and not adopting for free. So they would rather put an animal to sleep than actually trust the community to have a safe adoption.
Yeah, and it's, and again, I read a lot about brain biology, and we know that our brains default and emphasize the negative. So, for example, if we had out of 100 experiences today, we had one bad one, that is the one we're going to carry it with us. We're going to think about it when we go to sleep. It's going to keep us up at night, and we're going to talk about it. Our brain naturally emphasizes the negative. And so my advice to all of us, and me included, and you included, Mandy, we're all just people, right? We have to always step back and say, wait, am I amplifying this? Because maybe that's just a small part of it. And when you do that and you step out and trust, that's where the magic happens. And I've been humbled by the progress that my recommendations have made. I can promise you bigger and better and farther and faster than I ever thought. I was like, you did what?
Yeah.
You did what? I mean, it's been really, really humbling and amazing to watch these shelters just take off.
Yeah, no, it's incredible the amount of progress that you've made through your work. So why do you think using your mental health skills, we are so easily able to extend compassion to animals and not so much to people?
So I also think about that a lot because I am in the midst of all types of organizations in animal welfare at every single level, from the smallest to the largest, not collaborating as effectively as they can, and that's to put it mildly. And then there's many, I just had a phone call today about groups attacking each other. So I do think about this topic a lot. And I think that animals are really easy to love. Animals are unconditional and love us unconditionally. People don't love us unconditionally. And so a lot of people who don't maybe have good people skills gravitate to animals more so than others. And I also feel that in our society today, it seems like we're more concerned about being right. I'm more concerned about you hearing me than about me listening to why you're afraid to do that. And I think that extends far beyond animal welfare. So I just get that impression that everywhere I turn, we're not listening to each other and we're not respecting each other's microcosms. And quite frankly, that's how I feel I communicate best with, for example, municipal leaders. I talk to them about fiscal responsibility and constituent services because that's their microcosm. That's what they care about. So I'm going to step out of mine and into theirs, So I feel like we've lost a lot of that as a society.
Yeah, did you see that Ellen DeGeneres was sitting next to Bush at a game and everybody got really upset that she was friends with somebody who didn't have the same beliefs that she did? And it made me think that if we all have these hard lines that we believe what we believe is right, and we don't take the time to be friends with people who have different beliefs or to partner with people who may not have be on the same path that we're on, then we're never going to get anywhere because one of our greatest jobs is to influence. It's to really befriend people. And I mean, that's how wars are created, right? Is this hard line of, yeah. So I think I agree that we could be doing things a whole lot better. And I run a shelter, and I know that we have our struggles with other shelters, but mainly we all have the same mission. We just go about it different ways, and just to bring us back to that. So as far as giving people some actual practical skills on how they could be engaging their community, do you have a few suggestions and areas that would help? And I can guide you a little bit in this, like utilizing your community to be fosters.
Oh, for sure. So let's just think about adoption of animals in the United States, the smallest percentage happens in a shelter. So why do we feel like we are the only game in town or the experts, and we put up all these barriers when most people get their animals elsewhere, right? From the street or whatever, friends and family, and those other scenarios. So that goes along with why do we have to be the only ones to care for animals? And so when, for example, let's just take puppies and kittens, Good Samaritans bring them to the shelter, and maybe they found them, maybe somebody left them on their doorstep or something. And why do they bring them to the shelter? One, they care. They want those animals cared for. Two, we've told them that by definition, we are the shelter and we have all the resources we need. So bring us your hungry, your poor, your everybody, right? Your bottle babies, and we have all the resources. That's not true. And we've never asked the question, hey, wait a minute, Mandy, Good Samaritan. Hey, could you foster these babies? Well, no, I mean, I don't have the money to, you might say, I don't have the money to sterilize them and vaccinate them. I can't go out and buy food right now. No problem, Mandy. We're going to actually do the preventive care. We're going to spay neuter. And if you need food and litter for the kittens and cats, we're going to help you with that. Now will you be able to foster? Heck yeah. And we have lots of data that supports when you do. I mean, it makes sense, right? Maddie's did a survey just to prove it in 2015. And shocking, here's what it found. Spoiler alert. When you help people and give them resources, they're more likely to help you. Now, is that better for those babies? Heck yeah. Is that better for the shelter? Heck yeah. I mean, it's better for everybody because the shelter should only be used for animals where there's no other option. And in Jacksonville, I have this in the playbook example from Jacksonville. They never did this program, but it was the first time they were not euthanizing for space. And they were like, oh my gosh, if we take any more animals in, we're going to have to euthanize for space. So they said to the Good Samaritans, hey, can you just foster these babies and we'll help you? They went from a couple of hundred fosters a year to a couple of thousand a year. Now, they are a well-oiled live outcome machine. Don't try this unless you are a well-oiled live outcome machine. You need a setup to have those babies placed permanently, right? But they went from several hundred to several thousand a year. And just by trusting their community. And now, mind you, we're going to have this number for you to call. We're going to help you through this. We're going to answer your questions. We have an information package. It's on our website, all of those things. So the question becomes, why wouldn't you do that?
Right.
Why wouldn't you do it? That's the question, not are you doing it? Why wouldn't you?
Well, and I know for us, we used to have to go through basically almost like a blood test to foster for us because we were, again, so scared that we were taking these animals and we're putting them into homes and we need to insure. And I think that we as animal welfare have done ourselves a great disservice in sharing so many of our negative stories to try to fundraise for our organizations. And in doing so, we've created an environment where everyone believes that everyone is bad. And the vast majority of people are good and kind, like you said, and really have the best intentions. And we saw the same results when we started to be open. We had a new manager come on. We had a stack of foster parents like this big that were declined. We started calling all of them. And we went from helping specifically really cats. I think we helped around like 800, and then we went up to over 1,300, and all of it was because we were utilizing fosters in a different way and being more open about it. So what about, this is a hot topic, I'm leaning in because it's a hot topic, shelters partnering with private practice veterinarians and building that community resource.
Oh gosh, I can retire in peace if that happens. As a veterinarian, I'm just heartbroken about this huge chasm between sheltering and private practice. And I really feel if I had my own private practice, the shelter would be my first stop. Boy, I'm going to partner with that shelter because they're spitting out more clients and patients than anybody else in town.
Yes.
So I really hope that this continues to get better. There are Open Door Veterinary Care is a new organization that opened as a for-profit, and their test hospitals. There's one in Asheville and there's one in Toledo, and they are out to prove that a for-profit, you can have a financially beneficial for-profit veterinary hospital that is also low cost, high volume, and they proved it already. So very exciting things happening in different ways on that topic.
So I think, coming again from a shelter perspective, that I think that we, on both sides of the coin, we trigger each other's fear. So we get, this doesn't happen that much anymore because we really work with our community vets at a higher level. We communicate with them a lot better than we used to. But let's say a cat came in and would have upper respiratory, and the vet would say, oh, we're seeing so much of that from that shelter. I don't know what they're doing. And so then that person comes back to us and wants us to pay for their veterinary treatment because this vet said that there was a lot of upper respiratory. But the vet never comes to the shelter to say, how can we help you? Is there anything that we can do to assist you? And so from a shelter perspective, our hackles go up, right? Because it's our reputation and we're doing the best we can and we don't know, what we're doing wrong. And then if you, as a shelter, provide veterinary care, then the fear aspect on the private practice bumps up. And so I think there's a lot of work to be done, understanding each other's stories, like why we're in this and how do we come together.
And you know what? It has to be mutually beneficial for both parties, like anything else. You want to make sure everybody gets up from the table happy. And for a private practice, it's their bottom line. It's their business. So it has to be financially viable. And the other part of that is a lot of times they don't have the understanding that the clients that a Humane Society or perhaps a nonprofit clinic are seeing are mutually exclusive from their client pool. And so it's actually not hurting their business. And there's another, I just have Jacksonville in my head for some reason, because when the nonprofit spay neuter clinic opened and started a veterinary hospital, there was a private veterinary hospital immediately across the street. Immediately. Guess what? His business tripled. Why? Because the other clinic was so busy. He got all the spillover. So it tripled. But it was a very beneficial for him. So I thought, wow, that's such a great example, It has to be beneficial for everybody, but also people think, oh, private practice, veterinarian's a veterinarian. Shelter medicine is a specialty, just like any other specialty. So private practitioners, we want them to be educated about shelter medicine. They don't have to be experts, but we need them to be educated. So that's something that's ongoing.
Yeah, it's definitely a different world with different vaccine protocols and then just the world of information around infectious diseases and how that herd management is definitely unique. And that's where there's almost, from my perspective, not as much respect from private practice companion animal vet medicine over into the shelter world. But we deal, like, it's amazing to me because we will have thousands of animals entering our shelter. Like, we have to really be on point with our care. So we end up being somewhat of the experts around herd management, but
absolutely,
but we're not necessarily treated that way. So I'm really hoping that through the work that University of Wisconsin is doing and all the information being shared with shelter medicine, that will cross over and there will be more shared information and a higher level of understanding.
And I actually have seen it improve drastically in the decades that I've been in animal welfare. When I first started at the Humane Society in Broward County, what year was that? It was 1997, and veterinarians asked me if I was working there because I couldn't find another job. And I no, in fact, I moved here for this particular job. So that doesn't happen anymore. So now it's like, wow, this is impressive and this is amazing information. And so I definitely have seen a big improvement in that area for sure.
That's great. Another way that I feel like our shelters and communities can work together and is in this idea of not having their animals need a shelter. So saying, as a shelter organization, when someone calls or needs help, that rather than treating them like, that they're not caring for their pets or they don't care, that they say, they empower them with the respect that they love their pet and they just need a little help. And again, it goes back to that influencing, right? That we're going to provide people with the resources. They may do things differently than the way we would do them, but we provide them with the resources and respect and see what happens. Is that part of your consulting work, is training the shelters how to do that?
A huge part of it. And I always start with the disclaimer that I was one of those judgmental people 20 years ago. I thought if you left your pet in the shelter, you simply didn't care. We never even thought to help. And so now imagine it's, I'm making up for lost time, because it's heartbreaking for me to think, oh my gosh, I judged all those people when they just needed help, as we all did. And now we know better, we know differently, and we know that animals just entering the shelter, just the fear, anxiety, and stress of what the heck is going to happen, those are all negative things for animals. So our shelters should be used for pets who have no other alternatives. And what's better for the pet owner and the pet but to do a direct home-to-home adoption? There's nothing better than that. I mean, if they can't keep their pets. Of course, number one, if they can keep their pets, to help them keep their pet. But if they can't, then to do a direct adoption, because we all know all that information just gets lost in the system. And so now somebody adopts the dog could have been, trained as a search and rescue dog. You might never know because they didn't capture that information. It wasn't related to the new owner type of thing. So it really is, again, it's about stepping out of our microcosm and stop being judgmental about people.
Yeah, and working, I guess, part of it is also talking to our community members in a way that allows them to almost fall in line with your own belief system. So when they call about the neighbor's dog that's barking all day or barking all night and they want to know what to do they report it, saying, well, why don't you go over and talk to your neighbor? Oh my gosh, talk to my neighbor? Like, I'm not, what? This actually idea of, and you spoke about it in your Fear-Free webinar, is punitive versus collaborative. And we are, as a society, are trained to go to the punitive, that if we want something done, then we better, put money on it, or we need to charge people with an abuse or a crime. And that's one of I have a concern. It's not going to be very popular, but this idea, I love that Trump just signed the bill to make animal abuse a felony. What I'm hoping, though, is that in shelters, municipal shelters, that there are really good measures to define animal abuse that aren't things that we could be doing to help people with their pets. Do you know what I mean? Yeah. Like, that pet is underfed and we're going to charge that person with a felony, but is that serving the greater purpose, or should we be saying, what if we were able to help that person feed their pet? Would we see a difference?
Yeah. On that topic, I do feel like I do have confidence in shelters that they would err on that side and say, how could we help? Somebody that if it really was a resource problem, like maybe the person is starving too. Right. So I really do have some level of confidence that wouldn't be a felony, like if it was something like that, because for the most part, all of the state laws are addressing cruelty. And then the details and how, what happens with them. Are they held for a certain period of time during the court case, or can they be, all those things? Those types of rules can be established at the ordinance level, but the states are where all those cruelty issues are.
Okay. Well, and this is why I love you so much, because we don't really live in that world where I'm at. So my exposure to how cruelty cases and things are handled is very limited. And I know that's a lot of the work you're doing is in these large shelters.
And I'll tell you another thing is that, first of all, just pressing charges for cruelty is quite extensive. I mean, there's so much documentation and things that are needed over a period of time. And you also have to have malicious intent. So somebody who just can't afford, they wouldn't be charged with a felony. It wasn't, they're skinny too, and they're having trouble making ends meet. It has to be malicious intent.
Got it. Yeah. Okay. I appreciate that. So for everybody that is watching and listening, I want to share that Dr. Pizano wrote the Best Practice Playbook. We are actually mentioned in the book as a best practice for our home-to-home program. It's awesome. Thank you for that. And then that was actually the first time I met you, was at the HSUS conference where you were signing books. That was really fun. You pulled me in there. So I just wanted everyone to know that at the end of this, we will actually have a link, an Amazon link, where people who are interested in purchasing the playbook can. A lot of really fantastic information and resources are shared in here. So I appreciate that you took the time, and it was a lot of time to put this thing together.
Yes, and I'm so excited, and thank you so much. It did and it didn't. People say, how long did it take you to write? And I said 55 years. But it was in 2013. I've literally been writing that report for every assessment. It's the same recommendations. And so really, that was, Dr. Hurley called it my brain dump. It was the assessment report. So because it doesn't matter where you are, east, west, north, south, rural, urban, large shelter, small shelter, it's all the same principles. Mm-hmm. We face all the same challenges. Your community is not unique, I promise you, and the solutions are universal too, which is the greatest message. And so the playbook is intentionally written for everyone, for municipal leaders, shelter direct, the kennel staff, the pickle boy, anybody who cares about animals, funders. It's really written so that everybody sees how they're all piece of this puzzle in a positive way.
Yeah, and I would say even people who, like you said, funders and community members. There's a shelter that you and I have both spoken to, and I cannot remember their name, but they were making, because of your assessment, they were making fantastic changes to their organization. I mean, and drastic. I think that's one of the most exciting things is a lot of people go in and do consult calls, but you get really positive, quick action from these shelters. And this particular one, I was having a phone call with and said, we're doing this. So what they did was they stopped taking stray cats in. And so you've got this whole...
No such thing as a stray, everybody knows.
Okay. Their fellow shelters around them that were private shelters and rescue groups had all been attacking them for their high euthanasia. So then they make this policy change. They're able to better manage their intake. They're managing their animals. They're getting great live release rates. And now all of those organizations start attacking them for not taking in these cats.
Okay, but let's clarify. It's not that they're not taking them in. It's that instead of putting them through a shelter system, holding them hostage for a stray hold that's not productive, that is less than 2% chance of reunification, a lot of times housing them inhumanely in spaces that are too small so that they get those upper respiratory infections. Instead of doing all of those things, which equals cat suffering, dog suffering, and people suffering. You sterilize them, rabies vaccinate them, ear tip them, and guess what, people? You put them back right where they were already cared for. They didn't need you. I'm sorry. They didn't need, there's lots of animals that need you, but there's no such thing as a stray cat. They're not lost. They're smarter than people. These cats are 10 or 12 pounds. They should not be entering the shelter. And so, again, Mandy, I'm going to tell you, Dr. Pizano, circa 2008, I didn't agree with this program. Vintage, my friends call me the vintage Pizano. I didn't agree with this, but look at me now. The data is clear. So thankfully, we have all kinds of fancy studies, a lot of smart people with lots of letters after their name saying, this is really the way to go. But what about the cat? The cat's like, I'm 12 pounds. Do I look like I need you? Like, get out of my way. I was on my way to Mandy's house for tuna. I was on my way next to, doesn't, Dr. Becker live near you? I was on my way to Dr. Becker's dinner. And they didn't need our intervention. They were hanging out. So we reserve them space for those that are injured, maybe part of enforcement cases, really victims of cruelty, neglect, or abandonment. So in my mind, there's no excuse for a shelter not to do this program because it ends up being actually cheaper when you drastically decrease intake. It balances out. And Greenville was one of my favorite examples for that. 2,000 less cats went in the shelter that first year, and it was budget neutral.
Nice. So what's nice about this, even you taking the time to do the podcast, all the talks you do, is that the message has to get out there, not only to groups that haven't had your assessment, but to community members, to donors, to people. One of my main missions is to get this idea of being compassionate and nice to both people and pets out there, because I think that donors and animal welfare people, just anybody, they need to know that there's a better way, and that there's a way that we could be doing things that are more supportive of each other and of animals, because the way that we're doing things right now isn't. I mean, those shelters that are bashing the shelter that you've given support to, who is that serving? These poor people are out there trying to do their best, and that's another thing that I think gets missed, is that people don't go into animal welfare to make a lot of money. They're in it for the reason that is near and dear to their heart, and they may have a lot of fear that holds them back from being their best selves, but attacking them is only going to make that worse. Like, we have to be able, like you said, to understand the microcosm that everyone is living in.
Exactly. So let's circle back to that. So, perfect example, I was with a municipal attorney and I said, you don't need a stray hold on cats. Here's the program. So I would like you to eliminate the stray hold for cats in your ordinance. And she said, no, because we want to reunite the stray cats with their families. And I said, perfect. We have the same exact goal. Perfect. So last year and in all the years previous, do you know how many cats were returned? She did not. The year before, they took in 7,400 and something stray cats. And I always have to do the air quotes. And they returned 37. She did not know that, man. Do you understand? She didn't know that. She had the same goal. But if we didn't have that conversation, what I had was told, our county attorney won't eliminate the stray hold. That was it. Case closed. I said, well, I'm going to need to talk to her. Like, what is the reason? I knew what the reason was, but she didn't have all the information to make the right decision. And so, again, it goes back to just having a conversation. Why are you afraid to do that? Why do you think this would be a bad thing? And having a conversation. And we both have the same goals. The only way to get there and get there quickly and efficiently is to collaborate. End of story.
Yep. And that's where the magic happens, as you would say.
So true. Far bigger and better than I could ever have imagined. So I'm humbled by everybody's progress, and I'm so proud of all these shelters and our Million Cat Challenge shelters are doing. I mean, it's so amazing to watch. Like, we just feel like proud parents. We're like, whoa, just bigger and better than we ever anticipated.
Yeah, well, it validates your work. Okay, so before we wrap up, I know I'm putting you on the spot here, but you shared a really large number on the Fear-Free webinar, and I'll attach the link to that webinar to this podcast so people have the opportunity to watch it. Do you know how many lives have been saved due to the impact of the work you're doing?
So I never added up all these years. I would like to sometime in my free time figure it out. I was just thinking about that today, but I happen to have, I had data for 18 of the shelters that Cameron Moore, my colleague at the University of Florida, had put together. So 18 out of the 100 plus shelters, and we looked at the raw euthanasia number the year before the assessment and the number the year after the assessment. And there were 47,000 less euthanasias. And so you think, oh, well, probably you gave them a lot of money. But here's the thing. We were never funders. I've never been a funder. And so what that proves, when I saw that number, Mandy, I mean, I had tears streaming down my face. Grateful, right? But heartbreaking, because it's not about the money. And I thought, oh my goodness. And now my mission is to educate funders. So I have several clients that I'm funding. I'm a funder advisor. I just presented to Best Friends. I just presented to Maddie's to say, look, it's not about the money. Money's number two. Well, you have to have baseline budget. You have to have good program design. And then number three is, okay, now what are our gaps? Now where do we need more money? Mind you, I've linked shelters to over $4 million in funding after year one. But I was just looking at those numbers and really blown away that it proves it's not about the money.
Yeah. So if somebody, because you have your own business, your Team Shelter USA. So if somebody is listening and they want to support the work that you're doing, how would they go about doing that?
Well, if they wanted to support in terms of sponsoring, they could reach out to me either by my Facebook page, which is Team Shelter USA, and I hope you all follow me. I just started it, so I'm new into the social media realm, so help me amplify this message. But or they could reach out to me via Facebook or on my website, Contact Us button on Team Shelter USA. And I have funders sometimes give shelters the donation to pay for my assessment, and I love that. And I especially love when funders say, we'll pay for the assessment, and then if there's things that need to be done, we'll pay for that too. And the first thing that comes to mind you, I'm equal opportunity dogs and cats, but in humane housing, under the Association of Shelter Veterinarians guidelines, is a huge issue for cats in shelters. In 2018, twice as many shelter cats were euthanized as shelter dogs. So this is still a big issue. So portals, for example, I don't approve funding. If I have a funder advisor to an organization, I make sure everything is in place. Either that shelter has to do it or we fund it, right? So the portals, for example.
Okay.
Yeah. So, but yes, please reach out to me, or have a shelter that you want to reach out to.
That's amazing. Great. Well, again, I appreciate that you took the time to join me today, and appreciate all the hard work that you're doing. You truly are. I mean, there are so many people out there making a difference in animal welfare and out doing the good work. But I feel like the work that you're doing is so immensely impactful. Like, you're really, really getting in there and helping people, being direct but supportive, and just making a huge difference in this country for animals and for people. So thank you for that.
Thank you so much, Mandy, and thank you for Home to Home. I'm a big, huge fan, as you know.
All right, wonderful. You have a wonderful day. Thank you.